Hello, my name is Finn, and for my Comms 235 class today, I'm going to be responding to Delaney's speech about whether or not we should have universal healthcare in the United States, and I'm arguing the negative, that we should not have universal healthcare. Now, I want to start this off by recognizing the importance of the healthcare system and recognizing that there are serious flaws and issues with it, and that these need to be addressed and is important to many people in this country and their livelihoods. However, I do not think universal healthcare is the solution, and I think that not only will it not fix many of these problems, but that it will create new ones. Now, the first problem with universal healthcare is the cost. Now, if we're going off Bernie Sanders' Medicare for All plan, which has been the only universal healthcare plan proposed in recent years, the cost of implementing it would be $30 to $40 trillion. And now I didn't say trillion by accident, I mean billion, actual $1 trillion. That is more than our entire national debt that we've accumulated in the last 100 years as a country. We could tax the rich 100% and we still would not have to cover it, which means if we want to implement plans on this, taxes would go up greatly for the middle class and the lower class, and that is just not good for anyone. And Delaney talked about in her speech a lot of countries that do have universal healthcare, like Scandinavian countries, like the UK, and all of those countries have way higher taxes than we do and have constituents that are more comfortable paying those taxes that, especially in Scandinavian countries, could consume over 50% of someone's personal income. And not only would that be bad for Americans, it's simply that Americans hate paying taxes. This has been a concisive issue basically since our founding, an issue that the elections are decided on, and an issue that's been further trending to lower taxes, not raise them. And simply, this would not be this would not be good and would not be received well in the United States. And not only that, because of these taxes, over 70% of private households will be paying more under this new healthcare universal plan than they were beforehand, according to some data done and analysis done on this plan. So this won't even lower costs, it only increase them along with adding other worse benefits. And one of those benefits is the simple inefficiencies of it. Because there's a universal healthcare system and everything has to go through one channel, one source, then it creates no incentive to be efficient, and it causes great inefficiencies. Now, we have seen this in countries like Canada and the UK. In 2017, Canadians were on a waiting list for an approximately 1,040,790 procedures. And the median wait list for those surgeries was from 5 months up to a year. And that's the same in the UK. The median wait time was over 46 days. And now a lot of these diseases and medical emergencies, these are things that you cannot just sit on and wait. You think about cancer, you think about these other diseases that need to get caught early and treated right away. And with these waits, that just can't happen. People in the UK have died waiting on these waiting lists because of these universal healthcare systems that just push back and back when you can actually see a doctor and when you can have access to these hospitals. And we've also seen an example of one universal healthcare system in America, and that is the veteran system, the VA system. And that system has been struggling a lot and is not very good for these veterans. Now, we see this first in Spokane, in our own state, where the VA system failed to deliver more than 11,000 orders for specialty care, lab work, and other systems. And when they failed to deliver these, they didn't even get to alert healthcare providers that the orders had been lost. This is terrible. And this is just an example of when it's only one system, we don't have these other companies to hold each other in check and make sure that things like this doesn't happen. Because if the VA system wasn't under a totally monopolistic system like that, but maybe gave support and additional funds to find healthcare providers that work for certain veterans. If one of their 11,000 orders went missing, they could simply go to another clinic, go to another care facility or provider, but under this system, they cannot. And another reason, and we see this is a larger issue of just this monopolistic kind of nature of universal healthcare. With monopolies, they push down prices and they kind of create an environment for innovation. And we see that although prices is still a massive issue for the healthcare system and definitely something that needs to be improved upon, that second part, innovations, we see a lot because of this US system. According to the Nature Index for Health Science Outputs, the United States is far and away the greatest contributor of invention in medical research and new drugs and new antidotes and helping cure diseases. And their share in this index is 8,500, which is higher than the next 10 leading countries combined. So, but if we had universal healthcare, there would be far less incentive to keep on innovating in the medical field. Because we would love to be all rosy-eyed with it and say that we just keep on innovating to try to help people. But the bottom line is money drives. And when there isn't that incentive, it just won't happen. And although there are, and the US has a lot of anti-monopoly laws for this very reason in many other fields. And although there are some natural monopolies, those are our utilities, those are gas, those are oil, those are power lines, nothing that is as complex and ever-changing as healthcare, where every situation is different. And now another reason why this won't work is because, again, America is built on freedom and individual choice. If we had universal healthcare, people would not be able to find the plans that they work specifically for them. Every person is different. Everyone's body is different. Everyone's medical needs are different. And by kind of shoehorning everyone into one system, then they wouldn't be able to find the specialists that they need, and there would just be far greater inefficiency, and some people wouldn't be treated as specifically as they need to be. Now, again, I'm not denying the US system has problems. Costs are too high, coverage gaps exist, but scrapping the system entirely is so much harder and takes so much longer than trying to fix the system that's already in place. It's like burning down your house and trying to build a new one because you have some leaky pipes. We should focus on targeted reform, increasing price transparency, expanding health saving accounts, improving competition across state lines, and ensuring coverage for those with pre-existing conditions. If we do these market-based solutions that are already in the potential framework, we can make actual change instead of just hoping and working on our idealized systems that in actuality cost too much and will never be able to be implemented in our current governmental system in our current country. All right, thank you very much.